Hello, everyone. This is take two of the recording of the Vital Change. Thanks for joining today. I'm sorry I didn't hit record when we were doing our talk earlier today, but I am going to go ahead and send this off to everyone this afternoon. And please do not hesitate to reach out with any questions. So I am the first speaker, presenter of the 4 weeks. I'm Dr. Jessica Parker. Today we will be decoding functional blood work and perimenopausal hormones, and we're going to talk a lot about different things that you can do at home, tests that you can do at home, and then what to ask for your annual blood draw. So a little bit about me. I've been practicing as an Eastern medicine doctor for about 15 years. I incorporated functional medicine in around the time I received my doctorate in 2016. I actually had the experience to work as an acupuncture resident at Highland Hospital in Oakland, California. And during that doctorate program, it was a really unique program. We were able to work side by side with the Western medical residents and follow and shadow the heads of each department. It really just reiterated, though, that there's a huge lack in our Western medical system in the US, that this is not healthcare, but it's actually disease management or complication management. But my journey with integrative medicine, it really deepened when I started working or had a chance to work over a summer at Zhejiang Hospital in Hangzhou, China. And this is where I really witnessed like this incredible integrative approach to healthcare and really how bringing together different traditions that can create comprehensive support for women going through perimenopause. And what struck me the most was how this sort of a community-based approach, it removes shame, it's stigma, and that stigma it really helps women embrace a natural transition with confidence instead of judgment. If any of you follow my newsletter, I just told this story the other day, but one of my most formative memories for my current profession really was in the grand rounds session at the head OBGYN at the herbalist doctor at Zhejiang Hospital. And she sat at a large desk in a room packed full of women, and each patient would come up one by one and sit at the desk while she felt pulses and would ask questions. And what really struck me the most, but these sessions were not just about the doctor and the patient, that actually the entire room became a community of support. People were chiming in about their own experiences and really all while the doctor would nod and respond. And it just became this really incredible holistic community for everyone. You could really feel like the ease of some of the patients when they would hear stories from other women and just knew that they weren't alone. That was it just so groundbreaking for me as a practitioner. And this also gave me the inspiration to help put together this panel of these awesome practitioners to come together for you to present the vital change. So for any of you new to these concepts, but Eastern medicine, it's an acupuncture. It's a 3,000-year-old approach that treats the body as a collective series of systems that all work together. Where functional medicine uses lab work to help support the body to work as optimally as possible and to really find the root cause of health issues. So today we'll be exploring how these two approaches can help you understand and navigate through perimenopause with greater confidence and ease. So, what is happening to your hormones? Welcome to your second puberty. One thing that I love about what's happening in social media is that we have these resources to tap into now that really help with that collective experience. And we can learn from what other people are posting about. I guess it's kind of similar to like what I saw in these group sessions in China. And it also just creates a little bit of confusion on like what's the right way to manage symptoms. There's so much information out there; it gets really overwhelming, and mostly that's because each and every one of us will experience symptoms and change differently, which is the beauty of Eastern medicine. So you can have two people with the same symptoms, but the treatment will be different depending on like a myriad of different factors, lifestyle, and just personal situations. And we can find out a lot of that in labs too. But on the flip side, most allopathic or Western medicine, it's just looking to treat symptoms. So we're looking to treat the root of the issue. And then on top of all of this, HRTs are back in the mix. And after years of really confusing and just bad research, we're finally realizing that HRTs can play a hugely beneficial role in menopause. They're very low risk, and you don't have to live with your symptoms. I get a lot of questions about HRTs, and I have a lot of feelings about them. They are so, so helpful for treating symptoms, and really can quite literally can be a lifesaver, and they don't create health. They aren't treating the root of the issue. So that's just something to differentiate. And I do think it's an important distinction. I'm 1000% on board with the helpful effects of HRTs, and often support my patients to move into that direction. They're also covered by insurance. So that can be a really viable and affordable option for people to just feel better. And we also, want, when possible, to create health, to really balance within our current menstrual cycle, if we are having one, so that we can potentially avoid intervention, and that is totally possible. So to get started, I wanted to take us back to this lovely picture of sort of a variety of things that's happening all within when you're cycling. Now, this is like the most perfect normal cycle. This is not what usually it looks like as far as the top layer here of the hormone levels when you are in perimenopause. But I think it's important to learn and understand and pay attention to what is really happening. I know, like, from my experience, like, I had this male college roommate who basically explained to me what was going on with my menstrual cycle when I was in my 20s, what hormones were happening. I thought that you released a dozen eggs every time you bled. I didn't know that there was just one. So I have humbly spent the rest of my life completely absorbing the complexities of the menstrual cycle because of that experience. Many of you may be familiar with this, and congrats, but we will also look at a slide coming up that talks about the Eastern medicine concepts and how Eastern medicine looks at the cycle as a series of seasonal changes. So you can see here the follicular phase in the early part of the cycle. Generally, the metabolic system is low, hormones are low, everything's on the low end. This is the blood phase, it's more of the winter phase, things are on the low end. Then as we move into the estrogen phase, through the follicular phase before ovulation, that is the yin phase. Estrogen is very yin, and so that is when secretions are starting to build up. Our temperature is low, so kind of like that yin, lower, cooler side. Changes are happening in our uterine lining, and the estrogen helps thicken the uterine lining. Then we move straight into the ovulation phase. So there's a dip in temperature and then a spike. So that's the yang phase. This LH, luteinizing hormone, is when our body is ovulating and ready to release the egg. Then we have our temperature ideally starts to stay stable at a higher level, the chi phase, more of the autumn phase of progesterone. Now you can see this like really nice gradual arch. That's what ideally is happening with progesterone. What's happening in perimenopause, though, is estrogen is kind of all over the place, and a lot of times progesterone starts to dip. One thing is when people have PMS, that's often related to a quick and severe drop in progesterone. That's when you start to have that irritability and those symptoms of PMS, because the progesterone should gradually decline into the bleeding phase. We'll talk about some of that when we get into progesterone. So first, let's talk about what I like to call queen estrogen. Estradiol is the primary form of estrogen, and it's made on that yin phase on its way to ovulation. And it has a number of important functions for the body. So it builds muscle and bone. It maintains brain and heart health. It regulates and controls cholesterol levels. I have a lot of stars there because I want to talk about cholesterol in a future panel or a future slide here. Excuse me. It works with progesterone. It helps provide that metabolic benefit of more activity in that with progesterone. It helps prevent insulin resistance. It assists with belly fat, the ability to lose belly fat. So when we're in perimenopause, estrogen is going all over the place. And a lot of times we are making too much of it and our body isn't digesting it. It isn't detoxing it. So that's when we start to get that belly fat. So making sure elimination is really and detoxification is happening is really key here. It helps strengthen muscles, it boosts motivation. We're starting to, again, going from that inner winter phase into the yin phase, a little more activity. It helps thicken the lining of the uterus. Now, this is also why periods would be really, really heavy during that perimenopause time. There may be too much estrogen and it's thickening the lining too much, creating a lot of heaviness. Increase in breast tissue, also fibroids. This is another issue that can happen in perimenopause, again, from that thickening of the uterine lining. So we have three types of estrogen. We have estradiol. That's the most potent form and the dominant form that we have through our reproductive years. We have estrone. This becomes more prominent after menopause. So we don't lose estrogen. We do lose estradiol. Estrone is what becomes more prominent when we're in menopause. And then estriol, that's a gentler estrogen, and that's really significant during pregnancy. So estradiol, that really starts to fluctuate even in our 30s, between our 30s and 50s, really. And eventually it starts to lead to the loss of that estradiol, like I mentioned. Then so estrone becomes more dominant. But again, really making sure that detoxification is happening. That's super key. Making sure elimination is really solid with digestion. We want to get rid of excess estrogens through our body. We want to eliminate excess exposure to estrogens, even phytoestrogens, and synthetic estrogens like that are in plastic. So making sure that your body is detoxifying. When we move our bowels, it's releasing that. If we are constipated, what happens is the bowels sit in our system and we reabsorb what our body's trying to get out. And that can be a real problem with estrogen. So we have we're going to meet sister progesterone. This is made after ovulation, and we call this that chi phase. Progesterone helps with thinning the lining of the uterus. That can help counteract with those heavy periods from excess estrogen. And again, if we have too much estrogen and not a good balance of progesterone, we'll have really, really heavy periods during perimenopause. Now, progesterone also I like, it's not just thinning, it kind of makes it plushy and more supported, ideally for a potential implantation of the egg. But one thing that we'll talk about too in the next slide, but your period isn't just about making babies, it's actually about making hormones. So we'll talk more about why it's so important to make sure you have a balance of these hormones and have them a cycle as often as you can. So progesterone helps calm the brain. It increases the production of GABA, which is an amino acid that helps with relaxation, helps promote sleep. It reduces anxiety. Progesterone also helps reduce inflammation. It helps with forming the myelin sheath that insulates nerves. So a lot of women experience hip pain, a lot of inflammation, and like this arthritic pain during perimenopause. That's an issue with lower progesterone. It increases the metabolic rate, so it helps you again with like losing that belly fat, and having more energy and activity throughout the month. It supports the immune system by thickening cervical mucus, actually all mucous membranes. And so what this does is by having that thicker cervical mucus, having that really solid mucus membrane there, that's a protection. We call it the wei qi in Chinese medicine, but that helps protect us from external pathogens and things like that. And it also, progesterone helps with building bones. So as I mentioned, just another important thing to note, like many women experience PMS, and that's due to just a dramatic drop in progesterone, often with a skewed amount of estrogen in that early part of the cycle, which is why we want to do cycle mapping. I'll talk about that in a minute. But you do want to make sure there's just a more gradual phase of progesterone when you're still cycling, because in menopause, you do stop making progesterone altogether. So, excuse me. One thing that's just not discussed enough, I do think, is the fact that regular ovulation throughout your reproductive years, it does build significant health, and it has health benefits. So there's a great book, and I'll list this in the resources page. It's called the Hormone Repair Manual. It's by Dr. Lara Briden. It's a great, really tangible book that talks all about perimenopause. It's a super easy read. I really like all of her books and how she puts this information together. She has a chapter in her book. It's called "Cycle While You Can." Ovulation builds health. And I just changed the phrase a little bit around to cycle if and while you can, because a lot of people can't cycle or they have a lot of issues with getting a cycle. Now, this is where Eastern medicine is so awesome at helping people regulate their cycles. My specialty is in hormone support. I always joke all the time, like if someone comes in with ankle pain, I don't really know what to do, but if they come in and they haven't had a period in 6 months, that's my jam. I'm on it. Eastern medicine is really great at helping that cycle get going. So, if you can keep cycling, studies do show that regular natural cycles are associated with reduced long term risk of heart disease, reduced long term risk of dementia, longer, healthier lifespans, increased bone mass. And why is this? It's because that natural rhythm of estrogen and progesterone during each menstrual cycle provides cumulative health benefits over time. So every cycle does contribute to overall hormone health. Dr. Bryden actually uses the analogy that I love. It's like every cycle, it's like putting money into your savings account to then spend on your retirement. And again, if you're having any issues with cycling, this is where to reach out to a holistic practitioner to really just get your cycles back on track and try to cycle as naturally as possible for as long as possible. I do want to emphasize, though, something important. Birth control pills are not a substitute, and they do not provide these health benefits. So, actually, progestins, it's a synthetic form of progesterone. This can cause high blood pressure, hair loss, anxiety, depression, risk of breast cancer. It's like the opposite of what actual progesterone does. And I'm seeing this kind of cool trend that I right now in Western medicine. Because before, when HRTs were still considered risky and OBs were not giving them out, OBs would often just get women on the pill if they had really irregular, wonky cycles during perimenopause. And that's just totally not ideal. But now that we do understand the benefits of HRTs, the risks are much lower than previously thought. I'm actually seeing OBs now give out HRTs with as an estrogen patch or progesterone, and that's just such a better option than trying to give women the pill to regulate their cycles before they go into menopause. Um, I mean, the birth control pill, for birth control, I'm all about it. But birth control for hormone regulation, it is really not great. If you're looking for other birth control options, I joke, but I guess I'm actually pretty serious. The best birth control for the female reproductive body is a vasectomy. So those are some options there. So, what you see here is just this beautiful series of the seasons that I was talking about earlier. So, I taught gynecology at an acupuncture school in Oakland this past term. One of my guest speakers was Margaret Zoe, a fertility awareness educator. She just had this awesome presentation about BBT charting. We'll get into that next, and had this beautiful slide that I had to borrow for this talk because I just really loved the way she put this all together. One of my favorite things about Eastern medicine is how it relates the macrocosm to the microcosm and kind of vice versa. So here we see how each phase of our cycle is related to a season. Now, this is for the menstrual cycle, but this can totally continue on into phases of menopause. So even if you are not cycling, you can still have these seasonal changes within each month or whatever, however that goes for you. So we start with that blood phase again, the earlier part of the cycle, where you're bleeding, you're shedding the uterine lining. We have the inner winter. Hormones, metabolic activity is really low. The body and mind, it's purging, it's shedding. It's a good time for intuitive insight, clarity, introspection. Rest. Don't make any big decisions, kind of bleed on it, and then maybe tap into what you were thinking about later on. Nourish the blood with soups, stews, ginger, dongui, peony root, and gentle movement. So we're not doing boot camp while we're bleeding. And the follicular phase, the inner spring, that's the yin phase when that estrogen is starting to kick in. So that LH, luteinizing hormone, and FSH, follicle stimulating hormone, that's when it stimulates the egg follicle, which releases estrogen. The proliferation of new cells, cervical fluid is starting to build. That yin is very watery and fluid. Metabolic activity is increasing, creativity, expression, connection. We're moving into that more spring activity, so there's a little more energy for creativity. Work towards goals, maybe try something new during this time. You can nourish the yin with warming, nutrient-dense foods, beef, lamb, cooked veggies, goji berries, flax seeds, raspberry leaf, and nettles, and moderate exercise at this time. So then we're moving into the yang phase. We have the ovulation. This is like that spike in that luteinizing hormone, peak of fertility hormone, cervical fluid, and metabolism are really strong. The follicle is releasing the egg, so it becomes that corpus luteum. So the body temperature rises too. Yang is more heat. Yin is the more like down, cold winter time. But we're starting to move into that yang phase. Honor your desire, pleasure, and calling. That's where we tend to have more of a libido and just more like energy for things to do in the day. Strengthen the yang by eating the rainbow, sesame, sunflower seeds, nettle, raspberry leaf. These are all really good for yang. And moderate to intense exercise. So this would be the time to do the boot camp. So the luteal phase into that chi phase where progesterone is the dominant hormone here, inner autumn. So this is where growth and regeneration is starting to slow. We're preparing for winter that's coming next. The corpus luteum releases progesterone. So we have that again, that we should have that smooth sort of hill of progesterone at that latter part of the cycle. The inner lining of the uterus, again, it's kind of getting plumpy. Organization, productivity, boundaries. So tying up loose ends, I kind of just think about autumn. It's like getting everything ready for winter, putting away the summer clothes and kind of getting ready for the cooler climates. Support chi and fluid circulation by reducing salt, sugar, and caffeine. Rose, chamomile, nettle, sunflower, and sesame are all really great times for supporting that chi phase. And then moderate exercise to gentle movement. So now let's talk about how to track your cycle during perimenopause. I get people ask me a ton about hormone testing. There's a lot of confusing information. Again, awesome that social media is out there, but they're just like, it's overwhelming. And there's some really fancy, expensive looking tests. Many functional medicine and naturopathic doctors love Dutch testing. They're really expensive. I find they really fall short on getting the full picture. So I wanted to cover a couple of my favorite options that you can do at home. One super duper affordable, one less affordable. Both have their pros and cons, but overall, we are using these tools to look at an entire cycle. Not just one little snippet of trying to get a blood draw on day 3, for instance, or trying to get a urine test just right after ovulation. We want to look at what's happening over the course of a month, if not at least 3 months and more, but definitely no less than one cycle. So the at-home hormone urine metabolites test. These measure 3 critical hormones in your urine. We have luteinizing hormone, estrogen through the E3G metabolite, and progesterone through the PDG metabolite. So these are the metabolites of estrogen and progesterone. And the company that I use is it's called OVA, but there's so many more, and I will list the options and other ones that I like in the resources page. So you really just simply urinate in a cup first thing in the morning, stick the test strip and you leave it there for 10 minutes, and then you scan it on your phone and it uploads the data into your portal. It's super easy to understand. It's really easy to do. They map it out. You're doing this kind of like every other day throughout your entire cycle and not while you're bleeding. The benefit of this type of testing is that it shows those metabolites of hormones. So it's not just what we'll talk about with the BBT. We're really getting specifics about the estrogen and progesterone. But another classic and awesome way of tracking is called the basal body temperature. This is a great tool. It does only test the temperature. We saw that in that one slide where the temperature tends to stay low in the follicular phase, drops down and then spikes before ovulation, and then stays high during the progesterone or the the luteal phase. So ideally. So that's where we can see issues as if those temperatures are not within that kind of stable range. The patterns in general are going to be less predictable during perimenopause. So doing charting like this and the urine testing gives you so much more information. But BBT charting can be a little tricky. You have to make sure you do it first thing in the morning before you touch anyone or anything. You're no snuggling with your dog, cat, partner. You have to take the temperature, you have to do it at the same exact time every morning. This gives you that baseline temperature, and then you can track it. You really could do it as cheaply as $5. You can get a $5 BBT thermometer at CVS. It's different than a regular thermometer, but you can do that for a test and like write it on a piece of paper. They also have fancier ones where they that are still pretty affordable that actually download it into your phone, so you don't have to write it down. But this really can reveal a lot of information about those hormonal fluctuations because of the spikes and drops. And again, more importantly, we're getting this whole pattern and we're looking at different changes throughout multiple cycles. So, if it's sawtooth in Chinese medicine, that's an indication of liver qi stagnation. The body isn't digesting and releasing those estrogens. If it's super duper low, that might be an issue with progesterone or kidney yang deficiency, or it's your temperature just tends to stay really, really hot. That might be an issue of that kidney yin deficiency, and you're having problems with estrogen, which you're having those night sweats and all of that. So there's lots of information we can gather from either of these types of testing. So what I love to do in my practice the most is look at a blood draw. A functional blood chemistry panel is it's a little bit beefier than what you get at an annual, but we're going to talk about a few markers that you do get at your annual that you can ask your provider to get and make sure that they're covering those main macronutrient markers, and those can help you get some information about what's going on with your hormones too. But functional medicine generally uses a more narrowed range. The optimal range, it's different than the conventional range and a conventional approach to reading labs. So this cartoon just depicts exactly what I mean. The Western medical approach to looking at labs is really looking for disease, but you can clearly feel terrible far before you're in a diseased state. This could be someone's iron panel and they're within range, but they're almost at the total low range and they feel terrible. So we won't look at iron today. There's a couple of other markers that I would like to go over, but due to time, we don't have that. But when we look at that from the functional range, we're looking again, it's more narrowed. What is optimal? How to support the body and the system like far before you get to a diseased state. We want to support the body more from that holistic perspective so you feel better before you get into a place where you are actually needing more extreme intervention. So again, full disclaimer, we're only really looking at a snippet of a functional blood chemistry panel today. We're going to go over blood sugar markers, protein, cholesterol, and how these impact hormones. But please do understand there's more to the puzzle. And I teach acupuncturists this information. I'm in the process of creating more resources for all of us and everyone else, but definitely, I encourage you to seek out a professional that can dive into labs for sure. Like we don't even get a chance to talk about thyroid. Thyroid is really important. A lot of thyroid dysfunction looks like perimenopausal symptoms, and the treatment would be so different. Getting on HRTs when you have low thyroid issues, that might not be really effective. It might not help. So we want to make sure that we're looking at it a little bit deeper. But again, the purposes of this webinar is to really give you these extra tools that can help you, and things to look out for when you do get labs. So when we look at blood work for hormonal health, we usually start with understanding blood sugar dysregulation. It really does play a crucial role in hormonal balance. So we're going to start with fasting glucose. This is a measurement of blood glucose after not eating. It's a screening tool for blood sugar dysregulation and diabetes. For the most accurate results, this test should be taken fasting, so usually about at least an 8-hour fast. However, it is important to note that it's not only just a snapshot of your blood sugar at the single moment, but it does fluctuate. So if you were to take it 2 minutes later, your test results might be different. That's like why people wear glucose monitors, because it changes throughout the day so much. But it's kind of getting a baseline. And that's why I always test it alongside with fasting insulin and hemoglobin A1C to see the whole picture. Your primary Western medical doctor will not just naturally test fasting insulin. You do have to advocate and ask for that, but it should be a cheap test to add on, just so you get that full picture. The optimal range of fasting glucose is 72 to 86. So the conventional medicine range is 70 to 100. It's quite a bit broader. And that wide range really can miss all early stages of dysfunction. So when fasting glucose is decreased below the optimal range, we're seeing signs of hypoglycemia. In Chinese medicine, this relates to the spleen, the digestive fluids of the body, the lung, the kidneys, qi deficiency, blood deficiency. So low iron, red blood cells that aren't being really deeply nourished, that will start to show as low, like hypoglycemia issues. It can also indicate adrenal deficiency from chronic stress and cortisol release. So we'll talk about this a little bit deeper, but when we are overly chronically in fight or flight, the body will eventually start to just not be able to produce that. Usually it's more on the increase, but it will eventually get to the point where it can't release more and use more glucose or insulin. So when it's increased above the optimal range, we're seeing more signs of hyperglycemia. This is a little more common. Insulin resistance, early stage diabetes, metabolic syndrome. Again, body not detoxing estrogen. It starts to build up in the belly. We start to have more belly fat and weight gain around the middle. This does cause eventually a lot of issues like with heart disease. And there's a lot of links towards further complications because of metabolic syndrome. So in Chinese medicine terms, we're talking about damp heat. We call it qi stagnation. Again, we really need the bowels to be moving through the body. So with fasting insulin, this is the more accurate test for pancreatic function. The optimal range is 2 to 5. And in Chinese medicine terms, insulin measures the spleen yang, that spleen, like that digestive movement activity, the liver's ability to, again, to regulate qi. When it's decreased, we're usually seeing, with fasting insulin and fasting glucose, lower is type 1 diabetes. That's normal. But when increased, we're seeing those similar patterns of fasting insulin related to fasting glucose. So again, more tendency towards inflammation, metabolic syndrome, things like that. And why is this all important to perimenopause? Because blood sugar dysregulation can manifest as irritability, those hangry feelings. It's related to liver qi stagnation. Again, that blood deficiency, chronic fatigue, hormone imbalances like PCOS or low DHEA. When blood sugar is low, it also triggers the release of glucagon, epinephrine, cortisol, and growth hormone. So it actually starts to kick you into this chronic fight or flight. We should only be in fight or flight when we need to do something for survival, which we shouldn't be constantly trying to be in survival mode all the time. So on the flip side, when we have high blood sugar, this can lead to chronic inflammation, poor circulation, brain fog, fatigue, really feeling tired after meals. That's spleen qi deficiency, PCOS and that metabolic syndrome, insulin resistance and diabetes, damp heat with qi stagnation. So remember, sugar regulation and stress management are really key in hormone imbalances. Pay attention to your intermittent fasting routines. While some this is beneficial, it can actually exacerbate hormone imbalances, especially during perimenopause. I often get people off their intermittent fasting routines. It's just not helping them lose weight. It's putting them into chronic fight or flight. It's messing with their metabolism. Most of the time in the morning when we're trying to intermittent fast, we're not really like mellow. Work at morning is busy. We're trying to do a bunch of stuff. We're jumping on the computer, we're emailing, we're getting people out of the house, we're getting to our job, whatever. So that's a time where we actually do need to really nourish ourselves. If you're intermittent fasting, I encourage people to do it at a time of day where things are less hectic. So usually towards the end of the day or the afternoon. And that, again, that chronic activation of that survival mechanism, that fight or flight, this causes illness. So this is a mechanism. It's amazing for human survival, but it's just not meant to be turned on all the time. And I do think that that's really an issue with a lot of hormones, with hormone shifts. Our bodies are just not meant to act. They're not meant to constantly activate the sympathetic nervous system. And since cortisol is our hormone, it's a hormone that's activated for emergency. The body is going to prioritize survival over all the other functions. So, if our brain thinks that we're constantly running from the tiger, it's not just going to want to slow down and relax and make oxytocin, which we need. So we're just bombarded with, excess stress and excess information and excess activity. This really starts to strain that system that's activating cortisol. We get stuck in this loop, really using all of our energy and our sugar reserves for making this survival hormone like cortisol, rather than those deep yin and yang hormones, estrogen, progesterone, testosterone, DHEA. All right, proteins. So protein is super important to pay attention to. The optimal range here is 6.9 to 7.4. It measures the total protein amount in the blood. Serum protein, it's also made of dietary amino acids. They're called albumin and globulin. So if you look at a protein molecule under a microscope, it's like this dense knotted up ball, almost like a puzzle. And that means it's hard to really break apart and utilize. So not only do we generally need a higher level of protein to help with hormone production and hormone metabolism, but we need our body to break down the protein correctly. So that's what I love about teaching people to understand about their labs. It's not just about what you're putting into your body, very important. Lysandra is going to have our next awesome talk next week about nutrition. But from that Eastern medicine perspective, it's about that energy that your body has or doesn't have to utilize the food that you are giving it. So protein is considered yang in Chinese medicine. So we need that protein to support yang activities, circulation, muscle. It builds muscle strength, movement of micronutrients throughout the body, like iron, hemoglobin, magnesium. All of that is protein is ultimately what helps get our body moving that through the system. So we do need that denser compound to break down slowly, to give that deeper level of nourishment, unlike kind of that quick action and absorption of glucose and insulin. So we need to make sure that this is also adequate in your blood work here. So when protein levels are low, this can indicate malabsorption or low protein intake. So you might need a lot more protein and it might not be absorbing. Hypochlorhydria is really common. That kind of just is a fancy term for low stomach acids, enzymatic activity. It kind of relates to the spleen and stomach qi in Chinese medicine. So when protein levels are then, so I'm sorry, going back to that with that spleen yang deficiency, we need to really make sure that we're masticating food, deeply absorbing, breaking down that protein, pulling that puzzle apart. Um, so if you, oops, sorry, I'm having a glitch here. Yeah. And then, so I'm sorry, when things are high, we're tending toward that protein isn't getting broken down and starting to create inflammation in the body, having more of that stomach heat. Most of the time, I'm seeing it due to dehydration. And this is when I'm looking at other markers to see, like in the red blood cells, for instance, to see if there's other signs of dehydration. Okay. One of my favorite things to talk about is cholesterol. It's a little bit of a controversial topic, I guess, but the first thing to understand is that high cholesterol does not cause heart disease. Inflammation causes heart disease. We kind of have this really fluctuating, unhealthy cultural view of fat and cholesterol, and it totally doesn't even take into account high cholesterol, like the gut bacteria, glucose management, stress. And in fact, actually, high cholesterol in the body is often a response to chronic stress. So, in a way, it's really just the body trying to help us. It's always trying to do what's best for us. So, it's making more cholesterol in order to help our system make more of that survival hormone cortisol. And when we try to dampen that mechanism with statins, we're just really missing that underlying reason that our body is simply trying to protect us. The conventional range for total cholesterol is 100 to 199. And this is outrageously outdated. If you had a cholesterol of 100, I don't know if you would really be alive. Like, it's so low. And there's a lot of research now tending towards anything under 160 is considered dangerous. It's very slow to move into that direction, but it's also very nuanced. We do need to look at a full lipid panel, examining those sugars, protein, stress, environmental toxins, all of that, when we're understanding what's going on with cholesterol. But the range that I work with is between 180 to 220, because a higher level can actually be protective for some people. And people can tolerate higher cholesterol depending on other inflammatory markers that are happening in their labs. And again, it just could be an indication of inflammation somewhere else. So we need to suss that out with other labs. But as I mentioned, it should always be evaluated with a full fasting lipid panel. So what is super important when it comes to hormones is that cholesterol, it's the main steroid hormone substrate. It literally makes vitamin D, adrenal hormones, reproductive hormones. So those steroid hormones that are reliant on cholesterol are the sex hormones, estrogen, progesterone, testosterone, glucocorticoids, the cortisol, mineralocorticoids, aldosterone. We need, again, a balanced, healthy amount of cholesterol in order to make all of those. And in Chinese medicine terms, kidney yin, that again represents more of those estrogens and progesterones. Kidney yang is more of those testosterones, DHEA, the androgens. And I've mentioned this many times, but it's like this hormonal hierarchy. So when the body is stressed, the production of cortisol and aldosterone is just going to be preferred. The body's going to want to survive versus making our sex hormones. And that's why chronic stress just really has a profound impact on your hormones during perimenopause. So let's talk about the fundamentals of digestion and how this impacts hormone health. And it's really about treating the root cause of hormones and really looking at all the different factors that play a role in how we can digest, macronutrients, and how we can then build hormones. Many of us in like our modern lifestyle, we're just like eating on the go, we're grabbing protein bars, we're drinking shakes to try to get some sort of sustenance, skipping meals and then rushing around, intermittent fasting, all of that. And then we're also doing that all while getting bombarded with information like social media and emailing and texting. And it's just a lot, and this matters a lot to your nervous system because it has a profound effect on digestion. So the sympathetic nervous system, that's the fight or flight mode. It is designed to shut the digestion off and stimulate the frontal cortex, those motor skills to respond to the threat. Decreases that activity of digestion, decreases reproduction. It's in emergency mode. Digestion, reproduction are not emergency activities. But in the contrast, the parasympathetic nervous system, that's our rest and digest. That really increases the activity of the digestive system. And I find one of the most awesome ways to stimulate that parasympathetic mode, to get our bodies into that mode more often, is by getting acupuncture. That's why many of my patients like improve their digestion after treatments, and we're really focusing on other concerns and just getting to that lower, slower activity that our body does need. I love it and even myself, I like when you're on the table and the stomach is like growling and really active. That often is a sign of the digestive system finally getting activated and really working for the first time, maybe all day. So, we're just gonna wrap up here. Things to think about when you want to seek a professional help, maybe interpreting your labs or hormone imbalances. Again, the at-home testing for hormones is really, really easy to access. You can do it at home. You can get a lot of information. The blood draw information from a functional medicine perspective is a little bit more nuanced and detailed. But if you are experiencing significant perimenopausal symptoms that are affecting your quality of life, it's definitely time to consult with a healthcare provider who really understands more of a holistic approach, functional blood work, hormones. Again, I'm all about HRTs, and in our question and answer period, we talked a lot about that, and it can really be the the best treatment. We want to try to encourage the body to cycle as naturally as possible. We want to help alleviate extreme, heavy, irregular periods, mood swings. We can do all that really naturally without hormones. And HRTs are an incredible resource to really help our body get out of some of those really intense symptoms that are more difficult to treat. And they're covered by your insurance, so they can be really the most affordable option too. But I would say acupuncture and Eastern medicine is great for supporting and regulating periods, mood swings, debilitating hot flashes, and night sweats. I have herbal formulas that literally people will take, and the next day their night sweats are gone. Insomnia that's not responding to basic interventions. We have Chantel Traub, who's going to talk more about that. I'm really excited to hear her talk coming up. Sudden weight gain, even, you're doing all the things that you normally do, but your body is just holding on to that belly fat. There's a reason for that, and there's a way of treating that and getting the body and digestive system to function better. Brain fog that's interfering with daily functions. Let's also definitely seek help for that. So again, we didn't get to cover everything that I would like to talk about and approach. Thyroid, it can be a really major thing. Make sure that you're working with a comprehensive practitioner that understands and is willing to get extra testing and really try to consider your own relationship between blood sugar, stress, hormones, those sex hormones, and if you do need added help for that, we're here for you. So thank you again for joining me today. For those of you that were live, thank you for dealing with all of my weird technological hangups. Yes, I appreciate everyone sticking through there with me, but I just want to have a few takeaways. Again, perimenopause, it's a natural transition. It's not a medical condition, but really understanding your hormones, it can make it a lot easier to navigate. And if you can, regular ovulation through your reproductive years, that does provide like a cumulative health benefit overall. So cycle if and while you can. Blood sugar regulation, it's fundamental to that hormone balance. So really pay attention to addressing your blood sugar and eating habits throughout the day and making sure you're having a lot more stable blood sugar balance in the day. And then cholesterol, it's essential for hormone production. So eat healthy fats. That's really, really important for your hormone health, making sure you're digesting it, breaking down proteins, and supporting more of that parasympathetic mode. Um, this is just a really great way to create a foundation for hormonal balance. And please do not hesitate to reach out if you have any questions. I really encourage you to advocate for comprehensive testing and optimal ranges. Ask your doctor about them. We need to start having that conversation more. So if you have any questions for me or about my talk today, please feel free to email me at hello@rootandstemclinic.com. Thank you again for joining. I really appreciate everyone joining today.